am making a video on how ass backwards and retarded Obama's healthcare plan is. Where do I start? Okay. I know many Saw freak people I've seen, but I brought this up over dinner with my parents tonight, and it wasn't just Saw saying this, but the healthcare people, and, well, basically, when you're healthy, you pay for the doctor. Well, when you're healthy, you pay for the doctor, and when you're potentially ill from something that happened in the past, or you're becoming potentially ill with a terminal condition, you're either denied coverage, or you're put into some huge money thing. You're dropped from coverage, denied coverage, or you have to pay a huge ass fee. But one of their formulas for acceptance of coverage is monthly payments times lifespan minus the probability of illness. And if the sum is positive, they consider coverage. And if it is negative, they are denied. So that's their ass backwards formula. And yeah, I don't agree with that at all. They're forgetting one of the most powerful wills of all, which is the will to live. So in a way, they're choosing who lives or dies, which is fucked up. Okay, where else was I here? Yes. I know Obama is the first African American president. Yeah, but a lot of his healthcare plan is like the one healthcare plan. That plan is ass backwards because they're choosing who lives and who gets to die. But this happened to name withheld. My friend told me that this was their scenario. They got called into their healthcare provider office one day, and there was a problem with the coverage, but it turned out that they had surgery that was 30 years ago to remove a cyst from the bottom of the jaw inside their mouth, and they ended up with scarred tissue, and the healthcare provider manager said that scarred tissue can lead to gum disease, and somehow gum disease can lead to heart disease. But he said he paid his monthly premium for 30 years without so much as a cold or whatever. I mean, once he was in coverage, and once that he was actually sick, he was denied. So they're basically giving him a death sentence, which I don't understand why. How is that a good healthcare plan? Oh, I get it. Because of all the drunken hillbilly hicks get all the coverage, because somehow they're healthy. They're sitting on the porch tune and spitting tobacco. Somehow they're healthy, but somehow I have a feeling that the economically healthy Americans are going to have a healthcare plan and then get dropped from coverage in some weird ass backwards way. But the hicks, since they're they're ignorant and illiterate, white trash, just alcohol addicted, just ignorant and illiterate. So they're not gonna know anything about healthcare. They're just gonna have healthcare, and when they finally die from cirrhosis of the liver, they're gonna when they get cirrhosis of the liver and they're under the healthcare plan, they're gonna think, ooh, what the hell is that for? This is good. They're gonna get a hospital, but little do they know they're gonna get the big ass bill. The health company's gonna pay for it. I know. Messed up. Hicks get the coverage, and when the economically healthy Americans are healthy, they pay. But when they're sick, shit happens. I was on the internet one day just perusing healthcare stuff, and it said, in Norway, people who are healthy don't pay their doctors. But when when people are healthy, they don't have to. Damn it! When people are healthy, they don't have to pay. But when they're healthy, they pay. But when they're sick, they don't. Damn, why did I get so twisted? Whatever. When they're healthy, they pay, and when they're sick, they don't. So that's what a healthcare service is supposed to provide. When you're in a good state of health, you pay them for the coverage. And when you're sick and you're in a hospital and you get a hospital bill, they pay for it. So that way you're not in debt. But what's going on with all the healthcare is these companies, they're coming up with, they're coming up with policies where it says on these politicians, healthcare decisions should be made by doctors. No, they should be made by politicians. Now I know who they're made by. The insurance companies. all these decisions, all these ass backward things that are happening are in the hands of the insurance company. So once people start dying, finger of shame to the healthcare company. Finger of shame. But yeah, they're the ones that are coming up with these ass backwards conclusions of these formulas for healthcare. I am Jake 26779, and I bid you goodbye.